Last year, through the routine immunization, 383,166 doses of MR1 and 2 were administered to our children. And this half year, 228,779 doses of MR1 and 2 have been administered to our children for the half year. Measles is a dangerous disease. It is caused by the measles virus, which can kill or cause disability in a child. It is passed from person to person when droplets containing the measles virus discharged from an infected person's mouth or nose through coughing or sneezing are inhaled by another person. Children are at risk of getting the disease. Symptoms include fever, runny nose, skin rash, and red eyes. Complications include pneumonia, brain damage, blindness, and deafness. And deaths can also occur in a child when a child is infected. Rubella, known as measles, German measles, is caused by the rubella virus. It is spread through droplets transmission, just like the measles. And symptoms include cough, runny nose, skin rash, hearing problems, and red eyes. The disease, when it occurs in pregnant women, during early pregnancy, may result in miscarriage or the birth of a baby with congenital rubella syndrome. And such babies suffer from blindness, deafness, mental retardation, heart defects, and a range of health conditions. And all the two diseases can be prevented through measles rubella vaccination. And this vaccine is safe. Data has shown that over 40% of negative measles cases normally test positive for rubella. Therefore, rubella is also very common in our country. Since the introduction of measles vaccine, the disease has been controlled, and deaths among children due to measles have reduced drastically. The goal of the routine immunization program is to attain 85% coverage of MR among our children. However, Ghana's coverage for the first dose of measles-containing vaccine has been below 95% for recent years, due to, especially in 2020, as a result of the COVID-19 pandemic. Some children are therefore missed with the MR vaccine. And as the number of unvaccinated children rises, the likelihood of outbreaks also increases. The country has therefore adopted regular measles mass campaign to immunize a lot of our children within a short period to prevent measles outbreaks. We are once again organizing the MR campaign to vaccinate children against the diseases. We also administer vitamin A to children to improve sight, reduce blindness, and ensure their healthy growth. The theme for the campaign is Measles and Rubella Cure. Vaccinate your child now for good life. Objectives of the campaign are to increase population immunity against measles and rubella by achieving at least 95% coverage during this campaign. We want to also reduce sickness and death associated with measles and rubella by preventing new cases and associated complications. We want to improve access to measles rubella vaccination services for all children, especially those in underserved communities and high-risk districts. We want to improve vitamin A uptake in children in Ghana and strengthen our routine immunization. During this campaign, Greater Accra region is to vaccinate a total of 954,212 children with a vaccine. So all children aged 9 months to 5 years are to be vaccinated. And the campaign will be conducted across all the 29 districts in our region. Campaign dates are Wednesday, 2nd to Sunday, 6 October 2024. So we are starting today. Immunization will take place in health facilities, outreach posts, temporary immunization centers set up in schools, marketplaces, bar stations, churches, mosques, and all communities within the region to immunize all eligible children. After vaccination, children will be seated for at least 15 minutes for observation before they leave. I want to reiterate that the vaccine is safe. Some children may experience minor side effects such as headache, fever, pain, and pain at the site of injection. If this happens, please report to the nearest health facility and your child will be taken care of. Distinguished ladies and gentlemen, our media, I want you to remember that MR vaccination prevents measles rubella. These diseases are dangerous and can kill our children. They can cause deformities, such as blindness, deafness, brain damage. Even fully immunized children still need extra protection. So if your child is fully immunized, please, you need extra protection. Bring your child for the immunization. All children from 9 months to 5 years will be protected. MR vaccine is safe and effective. Vitamin A makes our children grow strong and healthy. So remember that the vaccination campaign, as I stated, starts on Wednesday, 2nd October and ends on 6th October 2024, that's Sunday. Your health are concerned. To our dear friends in the media, your role in providing right information to the populace to ensure uptake of the vaccines is crucial. You are helping to protect our young ones against these diseases. I urge you to continue supporting the service to promote positive behaviors towards the MR vaccination and vitamin A uptake. Use your medium to encourage vaccine uptake, dispel rumors and misinformation. You are an important stakeholder, and as role models, I encourage you to continue to advocate and create awareness on the need for the general public to take their children to the various immunization centers which we've mounted up in all our districts and in all our communities. I thank you for coming here, and I welcome you to this press briefing. Thank you very much. In fear, that is 2023. You won panel 383,166 MI manual. That's MI panel. And a few weeks, first half from January to June. You did panel 228,779 MI manual. Yes, Obia. Aka did that crama wa vaccine. We are eligible so by them, the vaccine. Into question of desire. A crown bet me a fact, the bet me a macron panel. Now, a brand is why yes, or poor panel as well. Wait me a papa, and any shade, a boama, a colonial more protection against our way.
So if you go to any polyclinic, any hospital, any clinic, you will have a team there vaccinating. We've also made provision for mobile teams to go around. We do know that some people will not be able to leave their homes, and so we plan for all of them. So there will be teams going from door to door, and then we would also have some camp house. So for hard to reach areas, we plan for those areas too. We are also going to vaccinate the children in these places. In the markets, yes. So the mobile teams will cover those ones, those who are not moving. So we've made plans for all these, and then we hope by Sunday we'll have covered all these people. We are also going to churches and mosques, all gatherings that we are able to identify. We plan for teams, and we'll visit all these sites to identify children and vaccinate them. Thank you. Vaccination, we take the first dose of the vaccine at 9 months, and then we take a second dose at 18 months. And then every now and then the country, like we said, organizes mass campaigns where we vaccinate all eligible children to give them a top-up boost to boost the immunity it gives against measles and rubella. So basically a first dose at 9 months and then a second dose at 18 months. That's the routine schedule.
What's the eligibility to the...
So it's from MR, it's from 9 months to less than 5 years. So if you miss the dose from any time, once you are less than 5 years, we can still catch up for you. So if you base it at 9 months, we can still give you, if you base it at 18 months, so long as you are less than 5 years, we'll give you a catch-up dose.
Please, a quick follow-up. What are...
Then,
No, there are...
once you pass 5 years, you are not eligible.
So if you have 5 years, you can take it. If you take 5 years, you can take it. You are not fine.
Yes.
And if it's a day before 5 years.
Yes, if you are a day before, you are eligible, but once you hit 5 years, you are not eligible. Measles, rubella, even adults can take it, but for programmatic purposes and planning, and looking at the vulnerable age group, is less than 5 years who are the most vulnerable age group for this. So for programmatic purposes, the country plans for these people. But 5 years and above, you can walk to any vaccination center and take the vaccine. So even adults can take it. Once you've not had measles or rubella before, you can go and vaccinate.
We are here to give information on the MR campaign that is starting today to Wednesday. We want to encourage all mothers, all caregivers to bring their children to the various vaccination sites which will be set up in the schools, in our marketplaces, in our communities, in the churches, in the mosques, and other organized areas to vaccinate their children against the measles rubella disease. We are also going to give vitamin A to our children to make them grow strong and healthy and improve their eyesight. So we are encouraging all. The vaccine is safe. The vaccine is safe. And measles rubella is a disease that can kill our children, cause deformity among our children. Therefore, we need to protect our children against this disease. So we are encouraging all to bring their children to take up these vaccines and ensure they are healthy, good, and development. I will encourage every parent, every caregiver to bring their children for the vaccination. Refusing your children vaccination causes them to be vulnerable to these diseases, which can affect them, their growth, can affect their health, can even kill them. So we encourage everyone to bring their children to the various sites for us to vaccinate them. Thank you.